A warm welcome to my session on the self-assessment questions, MCQ and ENQ. This is basically based on this topic, SGT topic, gallbladder and bile ducts. Okay, we come to question number 1, physiology of the gallbladder. Which of the following statements are true? A. The approximate water content of bile when it leaves the liver is 50%. B. The liver excretes bile at an approximate rate of 40 mL per hour. C. The rate of bile secretion is primarily controlled by secretin. D. The sole function of the gallbladder is to act as a reservoir of bile. E. The gallbladder secretes about 20 mL of mucus daily. And the answer is B and E. The liver excretes bile approximately 40 mL per hour, and E. The gallbladder secretes about 20 mL of mucus daily. Question number 2. Which of the following statements are true of gallbladder conditions? A. A porcelain gallbladder has no clinical significance. Strawberry gallbladder is due to the submucous aggregation of cholesterol, crystals and esters. C. Typhoid carriers can excrete typhoid bacteria in the bile. D. Surgery is advised if gallbladder polyps more than 1 cm are identified. E. Diverticulosis of the gallbladder can be demonstrated by cholecystography. And the right answer is B, C, D and E. B. Strawberry gallbladder. C. Typhoid carriers excrete bacteria in the bile. D. Surgery is advised for polyps more than 1 cm. And cholecystography can be used in the diagnosis of gallbladder diverticulosis. Okay, question number 3. Which is not true of gallstone ileus? A. It is due to the impaction of gallstone as the distal 160 centimeters of the ileum. B. It causes intestinal obstruction. C. Plain X-ray may show both features of intestinal obstruction and air in the biliary tree. D. Previous choledochoduodenostomy may be the cause of this condition. Rarely needs surgical treatment. The right answers are E. Rarely needs surgical treatment. Question number 4. The gallbladder is clinically palpable in the following conditions except A. Emphyema gallbladder, carcinoma gallbladder, carcinoma head of pancreas, hypercholesterolemia, E. Mucocele of the gallbladder. The right answer is D. Hypercholesterolemia. Question number 5. The pain in acute cholecystitis is relieved by food. B. May be precipitated by heavy meal rich in fats. C. Rarely associated by nausea and vomiting. D. Typically starts in the right upper quadrant and radiates to the right lower quadrant. Often relieved by intravenous PPI. The right answer B. May be precipitated by a heavy meal rich in fats. Question number 6. Not an indication for cholecystectomy in gallbladder adenoma. A. Size more than 1 cm. B. Associated gallstones. Age more than 60 years. D. More than 3 in number. And E. Asymptomatic. The right answer A, B and E. A. Size more than 1 cm, associated with gallstones, and E. Asymptomatic. These are not indications of cholecystectomy. Come to question number 7. The following statements are true of gallstones. A. Cholecystectomy should be performed whenever gallstones are found. B. Types of gallstones are cholesterol, pigment, and mixed. C. Gallstones can cause various complications, including intestinal obstruction. D. Acute cholecystitis can occur without gallstones. And E. An emergency cholecystectomy is the best option for acute cholecystitis. The correct answers, question 7, is B, C, and D. Okay, B, types of gallstones, cholesterol, pigment, and mixed. C, gallstone can cause intestinal obstruction, known as gallstone ileus. And D, acute cholecystitis can cause gallstones. They are known as acalculous cholecystitis. Question number 8. Which of the following predispose to bile duct carcinoma? A. Ulcerative colitis. B. Gallstones, gallbladder stones. C. Sclerosing cholangitis. D. Choledochal cyst. And E. Colorectal carcinoma. The right answer for question 8 is A, C, and D. Okay, predisposed to bile duct carcinoma, ulcerative colitis, sclerosing cholangitis, and choledochal cyst. Question number 9. Which of the following regarding gallbladder carcinoma are true? A. It is a rare disease. B. The majority are adenocarcinomas. C. The CA19-9 is elevated in 80% of the cases. D. A palpable mass is an early sign. E. Prognosis is generally good. The right answers for question 9 are A, B, and C. Okay, these are the true statements. It is a rare disease, majority are adenocarcinomas, and C, the elevation is around 80%. CA19-9. Question number 10. The pain in acute cholecystitis is relieved by oral intake, may be precipitated by heavy meals rich in fats. C. Rarely associated by nausea and vomiting. D. Typically starts in the right upper quadrant and radiates to the back. And E. Often relieved by intravenous PPI. The right answer for question 10, B, and D. Okay, acute cholecystitis, the pain is precipitated by heavy meals rich in fats, and typically it starts in the right iliac fossa and radiates to the back, at times to the right shoulder. Question number 11. Which of the following statements regarding cholecystectomy are true? A. The incidence of bile duct injury is 0.05%. B. A fundus first approach is helpful in difficult operations. C. Routine per-operative cholangiogram is mandatory. D. Post-cholecystectomy syndrome occurs in 15% of patients. And E. Cystic duct is free and easily dissected in Mirizi syndrome. The right answer for question 11 is A, B, and D. Okay, so cholecystectomy, the incidence of bile duct injury is very low, 0.05%. B, fundus first approach is helpful in difficult operations because chronic cholecystitis, there can be a lot of adhesions in the difficult operation. And D, post-cholecystectomy syndrome, around 15% of patients. Question number 12. Which of the following statements are true? The CT scan is more sensitive than ultrasound for gallstones. B. A plain radiograph can show radio-opaque gallstone in 10% of patients. C. An end viewing endoscope used during endoscopic retrograde cholangiopancreatography (ERCP) to cannulate the ampulla. D. Biliary scintigraphy can be helpful in the diagnosis of cholecystitis, bile leaks, and iatrogenic obstruction. And E. Magnetic resonance cholangiography (MRCP) has excellent diagnostic and therapeutic applications in bile duct disorders. The right answers for question 12, B and D. Okay. A plain radiograph can show radio-opaque gallstones 10%, only in 10% of patients. And D, biliary scintigraphy can be helpful in patients with diagnosis of cholecystitis due to bile leaks and iatrogenic obstruction, which is true. Question number 13. Which of the following are not true? For emphysematous cholecystitis, usually it is associated with acalculous cholecystitis. B. Most common in diabetes mellitus. Hair is seen in the lumen of gallbladder, causing symptoms of acute cholecystitis. D. Clostridium perfringens and other Clostridia are common causative organisms. And E. Indicates a more severe form of cholecystitis. The right answers for question 13 are C. Okay, hair is seen in the lumen of the gallbladder, causing symptoms of acute cholecystitis. This is not true. You see the air in the wall of the gallbladder. That's why it's called emphysematous cholecystitis. Question number 14. Prophylactic cholecystectomy is not recommended for which condition? A. Heart transplantation, diabetes mellitus, incidental gallstones at laparotomy, and gallbladder polyps less than 10 millimeters in diameter. The right answers for this question A, C, and D. Okay, so prophylactic cholecystectomy is not recommended for heart transplant patients, recipients, incidental gallstones and laparotomy, and gallbladder polyps less than 10 millimeters. Question number 15. Which of the following is not a pre-malignant condition of gallbladder? A. Porcelain gallbladder. B. Adenomyomatosis of the gallbladder. Salmonella infection. Phrygian gap. And E. Chronic cholecystitis. The right answers for question 15 are C, D, and E. Porcelain, C. Salmonella infection, Phrygian gap, and chronic cholecystitis. These are not pre-malignant condition for carcinoma of the gallbladder. Question number 16. The Courvoisier's law states that A. The most common cause of obstructive jaundice is a stone in the CBD. B. The jaundice patient with a palpable gallbladder is unlikely to have gallstones as a cause. C. Is always true for all cases of obstructive jaundice. D. Jaundice with a palpable gallbladder may be caused by cholangiocarcinoma. And E. May be true, but there are exceptions to the law. The answer for question 16 is B, D, and E. Okay, Courvoisier's law states that a jaundice patient with a palpable gallbladder is unlikely to have gallstone as a cause. D. Jaundice with a palpable gallbladder may be caused by cholangiocarcinoma. Okay, other malignant causes will be carcinoma ahead of pancreas and periampullary carcinoma. E. May be true, but there are exceptions to the law. Okay, there are always exceptions to this law. Okay, like cystic duct, double obstruction at the cystic duct and CBD stone, or a primary CBD stone may have a gallbladder enlarged. Okay, now we come to an EMI question, and with the theme types of biliary stones. Choose and match the correct gallstone type on the left with the description of the stone given on the right. Question number 1. They are usually solitary and pale and ovoid in appearance. Obesity, high-calorie diets, and certain medications increase the risk of these stones. The right answer for this is B, cholesterol stones. Question number 2. Bile stasis and infected bile predispose to these stones. This stone formation is related to deconjugation of bilirubin diglucuronide by bacteria. These are also associated with the presence of foreign bodies such as endoprosthesis or parasites. The right answer, D, black pigment stones, which are related to infection and foreign body in the biliary ducts. Question number 3. These are the commonest variety and are usually multiple and faceted. They have a crystalline structure on cross-section. The right answer is A, mixed stones, mixed gallstones. Question number 4. These are usually amorphous and contains an insoluble bilirubin polymer. They are usually associated with hemolytic conditions such as sickle cell anemia and hereditary spherocytosis. The answer to this question is C, black pigment stones. Black pigment stones are related to hemolytic conditions.